Yeah, good morning, good afternoon, good evening, friends from all over the world. Thank you so much for joining today's session in time. It is 12:31 and we want to start immediately. And so before we get into the session, allow me to invite Baraza Angola. Please introduce yourself and pray for us.
Thank you so much. I'm Ongola Barasa, a teacher by profession and currently the Global School Advocate by the UNSDN, and I'm glad to be here. So let us bow down and pray. Father, in the mighty name of Jesus, we want to thank you for this gathering with one heart and one purpose. God, we pray that whatever we are going to talk about here, our role in community development, please, Father, guide us so that in everything that we are going to speak about, the ideas we are going to share and everything, our actions and everything will be ones that protect the creation that you made and also uplift our communities. It is in Jesus' name that I pray and believe. Amen.
Amen. Thank you so much, my sister. And thank you for coming in handy. I know you're going to really add value to our conversation today. And friends, we are here as colleagues, we are here as friends, we are here as champions of education for sustainable development. We are here as leaders, we are here as students, name it. Everybody is welcome. It is a great joy to welcome you again and again to our Global Learning Circle. Last week, we reflected on the zeal behind community empowerment, that passion and inner fire that keeps us serving our communities, even when the journey is so difficult. We realize that sometimes you are forced to come out and serve the community when you are bleeding inside. But here we are talking about how then are we going to do this sustainably? We reminded ourselves that zeal gives us the courage to act, the energy to inspire, and the determination to keep going. And it is very, very important to remember that if you have to keep your team, you really need to keep on encouraging them, you really need to keep on inspiring them, and you really need to be determined to walk the journey with them. Now, today we take the next step forward. Our theme is our roles in community development. And what better way to learn than to hear from the vibrant voices of young leaders from Moi University in Kenya? These are not abstract ideas, they are real projects. They are projects that are on the way, going on, real challenges that they are facing, the real solutions that they're coming up with, solutions that are being developed by students who are proving that education is not just about the classroom, but about transforming communities. This is very, very powerful. How I pray all educators in the world could be in here just to see, just to listen to what is happening around students in Moi University. We will hear from three groups today. We have Tongaren, we have Kamoswar, and we also have Chepkorio. Yeah, Chepkorio. Now, each of these groups will bring unique experiences on health, environment, water, food systems, name them. Their stories will remind us that community development is not one person's task. It is all our responsibility. So I want to invite each one of you to learn fully tonight. When you come in, don't just come in with your face like, oh, I am part, I am. No, no, no. Come in wholly. Your head, your heart, and your hands. We want you to make use of the knowledge that you're going to gather here and appreciate what we are doing, what the young people are doing. Appreciate you, yourself, being here. And so have your heart. Bring out that passion of wanting to do it. because there is a difference between wanting to do something and having to do something. I believe you're here because you want to be here. And so, my friends, take time, get a notebook, pull out a notebook. Don't just listen, take notes. We have a chart. Share reflections on the chart. Any insight that you get to hear, any insight that you come across as we are sharing, put it on the chart. Ask sharp questions that can push these young leaders to think even deeper, because we are here also to engage them, to help them to improve on their projects. Most of all, stay with us from the beginning to the end. I've never had the challenge of people dropping along the way, but today I want to request, please stay on board, because the end has something that the start will not have, because each story connects to the next, and together they give us a complete picture of resilience, a complete picture of innovation and collaboration in action. By the time we close, I believe each of us will not only see our own role in the community development, but also the role of others more clearly. We will also feel inspired to take the next bold step where we are planted. So, with great joy, let us join this journey together. And to lead us in this, I want to hand over this program to two great ladies from Moore University. Allow me to recognize our esteemed facilitators for today's session. First, we have Professor Joyce Balidawa, a distinguished scholar and passionate advocate for education for sustainable development, whose leadership has guided countless learners to see education as a tool for transformation. And second, we have Dr. Gladys Akama, a devoted educator and researcher, deeply committed to community development, culture, and empowering the next generation of leaders. And behind the groups that we are seeing presenting, she is the pillar. Together, they will guide our reflections, helping us connect these students' projects to the broader vision of education for sustainable development. And so, friends, let us go to the reactions right away and use an emoji, whichever, love, a flower, ice cream, give them something as I usher in Professor Balidawa to take over the session. Today, I don't want to interfere. I just want to be there as part of everybody else. Professor, the platform is yours. Just play it the way you want. All the best.
Thank you very much. Good morning, good evening, and wherever you all might be. I am Joyce Balidawa, and I think Dr. has introduced me the best way you can actually hear about me. Thank you so much for this invitation. Thank you for honoring our institution, and we are here to share with you what makes us a university with a difference. It is Moore University, and more so, what makes our COPS program outstanding, and it actually produces outstanding products. I don't know whether you can see, let me just see, yeah. You can see my video. I can also see all of you. And I'm saying that community-based education and service has made Moore University globally known. And when we say Moore University, it's a university with a difference. We do things in so many ways, but our first and foremost is to develop community development-oriented healthcare professionals. The 21st century graduates are trained in a unique way through the COPS program. And here we are trying to make sure that in that program, we do training, we do research, we do outreach, we do extension, and we do community engagement. Imagine in a program. My colleague will tell you more about it. But as a result of that, we expect to produce the 21st century graduate. We are in the second quarter, all right? But let me tell you what the attributes we expect. You will see in their presentations about critical thinking. They will be analytical, they'll be evidence-based, they'll be proactive, and they will also be agents of change. And of course, definitely to communicate in community development, we have to make sure that we are giving information, we are educating, and we are also communicating. But at the same time, we also have to make sure we are actually technologically savvy. So thank you very much, Daktari, for that introduction. I would like to hand over to my colleague, who is the coordinator of the COBS2. For my background, I have been very passionate, as you've been told, to produce the best of the very best. But let me not judge myself. Let the world do the judging for me. So let me introduce my colleague, Dr. Gladys Akama. Dr. Gladys Akama is the coordinator for the Year 2 program. This is a group of students who have just come back from the field, and we felt that it's about time everybody gets an idea of what we do when we go to the community. I remember when Moi University was set up, and they said they're going to be training healthcare professionals with a community orientation. We used to be ridiculed and we were asked, are we training traditional healers? But believe you me, the scenario has changed. Community orientation has now become the pillar on anything that relates to healthcare. And believe you me, my colleague will be able to tell you, and even the students themselves will be able to convince you beyond reasonable doubt that the way to go, and especially if we're going to seriously partner with Global Alliance for Sustainable Education, and of course, we're also going to make sure that we are talking about education for sustainable development, then we are suggesting that one of the ways we can think about going and making sure that community is involved, because without the community, we really cannot get much. We cannot go very far. Who are we planning for, if not them? And definitely for us, our sing-song says, with them, for them, and by them. So I'd like to welcome my colleague, Dr. Gladys Akama, to tell you more about our COPS program. And then from there, she will be able to start the three programs, the three stations, which are making their presentation. Already we had a presentation by Mautuma, and we also had a presentation by Kabuchai. And now we are adding to those exciting presentations, 3 more stations this time. Thank you very much. Dr. Akama, when you're ready, please.
Good morning. Can you hear me? Good morning, good afternoon, and good evening.
Good morning.
Can you all hear me?
Yes, clearly.
Okay, it's a pleasure to be here today. Prof. Paridawa has been my mentor for so long. I joined Moi University and found her in the program. So I helped the skirts, and I think we are doing something good from this region. So today, I'm going to take you through what COPS is. I coordinate the COPS2 activities in the college, and I'm a member of the COPS subcommittee in the College of Health Sciences. And with me here today, I have the 21 station students. They went to 21 stations in western part of Kenya. We are in Busia County, 4 stations. Kakamega County, 3 stations. We are also in Uasin Gishu, 4 stations. Elgeyo Marakwet, 3 stations. And then we are also in Bungoma. Bungoma is one of our main bases where we are. So today, we have students coming from Bungoma, that is Tongaren. We have students coming from
Yeah, Professor Balidawa, you can come in and help us. We're seeing
Prof.
Gladys.
Balidawa, can you see my slides?
Okay, yes, thank you.
Is your network challenging,
Are you able
Dr.?
to see my slides now?
Yes, we can. Go ahead.
Can you see my slides? Are you seeing my
Dr., we can
slides?
see your
I've
slides.
shared my slides. Are you able to see them?
Yes.
Okay. So, let me see. Are they moving?
No, you're still
I
on
think
the
something
first
has
slide.
happened. My slides are not moving. Don't know, they're not moving. Let me reshare again. Are you able to see them now?
Dr., yes, they have opened.
Prof. Balidawa, are you able to see?
Yes, we can.
Yes, we can see.
You can see, okay. I don't know, they're not moving.
I think what you're gonna do, you can share the slides with, yeah, they are moving now. Good.
Now moving, Dr.
They're moving.
Shall I go back to the first one?
Yeah, and unmute yourself. You muted yourself.
So I'll take you through the COPS program at Moi University College of Health Sciences. And in Moi, we have adopted two main programs of teaching or teaching methodologies. We have what we call the SPICES model, where it's student-centered, problem-based, integrated, community-based. Our students go for electives, and we follow a systematic type of learning. Under this program, our students do what we call community-based education and service, where they go out for experiential learning. And for purposes of today's presentation, we are going to look at this community-based education and service, and now they stop, they're not moving. I'm going to take you through the program. I don't know why they're not moving again.
Maybe to help you, you can share the slides with Professor.
Yeah, Professor has the slides, JB.
Yeah, maybe Professor, you can share the slides on her behalf as she presents.
See.
Yeah. So you can stop sharing so that Professor can share the slides.
Yeah, let me just, So I'll continue talking about our COPS program.
Yeah.
The COPS program in Moi University started together in the College of Health Sciences, where we have 4 schools. We have School of Dentistry, School of Public Health, School of Nursing and Midwifery, School of Medicine, which has 4 programs. And in these 4 programs, all the students in the college, the 8 programs, they participate in the COPS activities. As you will see from today's presentation, each group that went out as a student from one of the silos. So from the 8 programs, we have students placed in all the sites where our students go. The program spans through a 5-year program. It's year 1 to year 5, where in year 1, the students get the theory of the program. They are taught the principles of primary health care in terms of the elements of PHC, universal health care, and the primary healthcare network in Kenya. So these students, after getting the theory aspect, go out in their year 2 program to the communities. They go to the rural centers, where now they transition from the theory to the practical. And in the practical, that is where now they get to the community to understand what are the health problems right at the community level. What problems are these communities facing before they come to the health centers for treatment? And our focus today will be in these COPS 2, where students are out there in the communities, mainly to address the primary healthcare issues in terms of prevention, curative, rehabilitation, intervention, impact, and innovation in terms of intervening to come up with solutions that are going to promote the health of these communities. So once they are out there, they have a weekly book that they use to do their activities. It's like outside Moi University College to the rural communities, where in health centers, they use the health centers as a barrack where they stay, but they move to communities where they get to community entry, they get to understand what are the cultural issues of this community. What is the issue? Where did they come from? What was their origin? What are the taboos in this village? What do the communities do in terms of childbirth, in terms of naming of children, and in terms of marriage and initiation ceremonies that are likely to impact on their health-seeking behavior? Once they have understood this, then they get to do a focus group discussion where they meet the key opinion leaders. They discuss with them the problems they are facing. They discuss with them the issues at that level and get to document their findings. Once they have done this, they map regions that they think this village are not exposed, and they get to that village and do an in-depth interview with the people to understand the issues at the community and come up with. While they're in the community, they also get to learn the administrative arm of the household, who is the head of the household, so that they can be able to communicate and be able to come up with behavioral change at that household unit level. They also get to understand the organogram of the hospital, who is answerable to who, what goes on in a pharmacy of a level 2 facility, what goes on in the outpatient department, how do they keep their records, what goes on in MCH, what primary health care programs by CBOs, by NGOs are taking place in this region. How is the uptake of the SHA, what we usually use as a social insurance fund? How is the uptake in that community? What are the topmost diseases for children and for adults in that community? And what could be the sources of these conditions? And then they try to educate the communities so that they can be able to sustain themselves in terms of promotion and prevention of diseases. While they're able to do their tutorials, we have set for them tutorial problems, and these tutorial problems address day-to-day issues that are health-related, but at the community level and can be prevented. So once they have done this, they have done their focus group discussion, they have done their one-on-one interviews, then the students are able to diagnose what we call the community diagnosis, get to know what is failing this community, how can we help them? And once they have done that, they give them a feedback, they meet in a baraza, the area chief calls for a meeting, they meet in a baraza, they discuss these issues together and come up with a solution together with the community so that they can make it a community-directed intervention. And once they have agreed, they do a report, they come back to the college, we assess them. COPS program in College of Health Sciences forms 27.5% of the core program. So if a student fails COPS, that means they repeat the year. So the students take it with the seriousness it deserves. And once they are out there, they come up with recommendations and they do a report, which we later share with the facility and with the community so that they can be able to implement. I don't know, somebody is saying something about the sound. Is the sound okay, Christine?
Oh, okay, fluctuating, but most of it we are getting.
Okay, I think it's my internet. So these are some of the challenges that the students face when they go out there. These students stay in the health centers. With time, our numbers have been increasing. And because of the increase in numbers, we are having a challenge in accommodating the students within the health centers. Remember, these students stay in those health centers from 8 to 5 every day as they go out to the communities. The base is the health center. So they have had a challenge in terms of accommodation. They have also had challenges in terms of transport. They cannot get to the facility, especially when it's wet and it's raining. The students are not moved. As much as the university gives them a van, sometimes in the terrain, the access to those regions is a challenge, but we are really trying to see that this program goes on and the students are able to meet their objectives. The other challenge that we have faced quite a lot is the issue to do with the group insurance. The county government want the students to go out there in groups with an insurance because they do activities. They go visiting the water points, they go visiting the treatment points, they go to the market centers. So they want the students insured in case of any accident out there in the community. However, the university has been able to graciously offer transport, get tutors to go and stay with these students and the drivers for the 5 weeks that are out there. The students cater for their own meals, while the tutors now support them in terms of the learning materials, carrying out the activities in the community, and being able to come up with a report that is tangible and can be used to make recommendations to the community. I've done a presentation that shows what goes on in the community, what they do, but I don't know what has happened and we can't share it. But in a nutshell, that is what the students are doing in their year 2. Once they move to year 3 now, they do a research, they have a problem that they saw, do proper research, come up with a proposal that can be fundable, and then do this research in year 4. In year 3, they just develop the proposal, and in year 4, they do now what you call correction. And then now in year 5, for the 6-year program, for the 5-year program, and the year 4 for the 4-year program, the students go for county health service management. And in this health service management, they are going to shadow the team leaders in county level hospitals. These are the equivalent of the national hospitals and the level 5 and 6 hospitals in Kenya, where they learn how to be a leader in that institution. They learn to take up the role of a medicine. They learn to know what happens in day-to-day activities when you are in procurement, when you are in finance, when you are in human resource management. So by the time they transition to be health officers out there, they are able to manage the facilities as managers, all as section heads. So in a nutshell, COPS is a program that has transitioned and metamorphosed and given us 21st century products that are easily sought after in Kenya in terms of their experience in community engagement and in leadership skills. So today's presentations are going to showcase some of the ideas the students came up with. They went to the village for 6 weeks. They are now back to the station. They start their classes tomorrow, and they're going to share these ideas to the faculty members and to other people from School of Business and School of Public Health who have joined us, so that we can form a team and see how best we can come up with community-directed interventions that are going to assist these students come up with projects that are doable and scalable. So this is what we are going to listen into today. We have the 3 groups, and they are tackling all the SDGs from 1 to 7, majority of them, because they're going to talk about education, they're going to talk about nutrition, they're going to talk about water and sanitation. So in a nutshell, they are trying to cover all the SDGs in one. They're going to talk about. So kindly listen in and read the topics so that it can be something tangible and scalable. Thank you.
Wow, thank you very much. So which group starts?
We are starting with Tongaren. Sorry, Tongaren there it's written wool, but they are doing the chimney. Tongaren group.
Sorry, my apologies for that technical hitch. I have a new phone and I'm yet to master it. But I have sent the slides to Dr. Christina. Hopefully we should be able to share it. Now, I just wanted, let's just check the students. Which station are we starting with? Tongaren, are you ready? I did see you there. Tongaren?
Hello, I'll be screen sharing for Tongaren. I'm asking for the permission to share.
Linson was the presenter for Buchai, but is now helping out with Then, thank you.
Okay, Linsen, your co-host, please go on and screen share.
Yes, thank you very much. Good morning, good afternoon, good evening. My name is Manuel Odhiambo, a student from Moi University, and I'm very grateful and glad to present before you this day. And in case you have a question or maybe you want to make a concern, you are allowed to interject. And maybe if I'm not clear, you can just alert me and I'll sort it out. So on 14th July, we were able to go to the field. Specifically, my group, we were 11. We went to Tongaren Health Center and we spent there 5 weeks. During our stay there, we were able to carry out community diagnosis and we took some pictures which I would like to share with you today. So, I'm not sure if to your right, yeah, there is a picture of a woman and her children, and there is a smoke billowing from where she is cooking, and to the left there is also a picture of a lady. She seems to be washing the utensils. So the photo to the left we took from the health center, while to the right we took in the community. Next slide. And the next photo also to the right, there is a picture of a woman and her 2 children. And to the left, there is a picture of a smoke billowing from a house. Yeah. The next picture. So I'm not sure if you can zoom into the picture in the right, there is a smoke billowing from a house. And to the right is a project we would like to carry out. That's a picture that's a project we'll like to carry out to the community. So from the images we have shared, it shows a smoke billowing from within. That's a strong indicator of poor kitchen ventilation and reliance on traditional cooking methods. This situation is not uncommon in many households in the community, and particularly where they use firewood and charcoal or kerosene as their main source of energy. The heavy release of smoke signifies incomplete combustion of fuel, which not only pollutes the immediate environment, but also accumulates indoor, creating hazardous living conditions for the occupants. Inside such kitchens, the air becomes dense with the particles of soot, grease, and carbon monoxide, making breathing difficult and uncomfortable. Prolonged exposure to these conditions will or may lead to respiratory tract infection, chronic bronchitis, and eye irritation. And in severe cases, it may lead to long-term cardiovascular complications. Beyond the health complication, there is continuous smoke exposure, which may lead to discoloration of walls and ceilings, and also persistent odors in the home. From environmental standpoint, uncontrolled smoke emission contribute to air pollution, reduce overall air quality in the neighborhood, and may even worsen climate-related issues through the release of greenhouse gases and black carbon. Thus, the images may appear to be simple, but in reality, they represent a much broader public health and environmental concern. That's why we felt there is a need for change, and we came up with a project which we named the Kitchen Chimney Project that I would like to present before you today. So, just like I've said, The problem that we mainly observed or captured in the area during our community diagnosis is poor kitchen ventilation in the household, because most of the household, they still use the traditional kitchens with open fires. They still use firewoods, they still use charcoals, they still use kerosene, and there is also high exposure to smoke, which may lead to respiratory issues and also eye irritation. And what we also notice that most of the communities, they lack awareness about the dangers of the indoor smoke pollution. And a few individuals in the community can afford the chimneys or not at all. Our customer segment, we have the primary customers, the secondary customers, and the early adopters. So our primary customers will be the community members themselves, especially women, children, and elderly exposed to indoor cooking. And our secondary customers will be local schools, health centers, community groups promoting public health. Our early adopters will be the families that are already complaining of the smoke-related diseases. Our project is unique in that it offers a healthier home, cleaner air, and stronger families. And it's also affordable to the communities, and it will prevent the respiratory disease and improve cooking comfort. The solution to the problems will be to design and install low-cost, which are locally made kitchen chimneys, and we'll use durable, easy to maintain materials. Of course, we'll get them from the community. That's the brick, the pipes, the iron sheets, and the clay. And just like I mentioned earlier, the community lack awareness about the dangers of the smoke. So we'll provide community educations, workshops on indoor air pollution and URTI's prevention. And we'll also partner with the local artisans for chimney construction, making it community driven. Partnering with the community local artisans will also help to empower youths. So our project, we plan to use these channels to make it achievable. So we'll use door-to-door community awareness campaigns. We'll go to health facilities such as clinic, dispensaries for sensitization. We'll go to churches, barazas, and community gatherings. And some of these we were able to go when we were in the COBS program in the past week. And also we'll be able to print posters and demonstration and word of mouth referrals. We plan to get our revenues from direct sales of chimneys or by installation of the chimneys. And we will also partner with NGOs, county government, or CBOs for subsidies, and also possible financing. That's household pay in installment. And also by training the local artisans will require something fee-based workshop, like if I say like that, yeah. So we estimated the budget for each household, and I will go through it. Chimney construction will require. Sorry for what happens. So chimney construction will require bricks. That's 100 pieces. Each piece goes for around 20 bob. That's around 3,000. Will require cement for 4 bags, each at 800. That will estimate to around 3,200. Will also require metal chimney pipe, around 4,500, and we require skilled mason labor. We'll get them from the community for 4 days, each day at 1,500. That's amounts to 6,000, and also will require unskilled helper labor from the same community for 2 days will each at 800 will be amounting to 1,600, and transport of the materials we estimated it to be 4,000, and heavy duty hardwood stock metal will require one, that's around 7,000. Nails and screw pins for around 1,500, and for contingencies 15% of the total, that's around 4,500. So we'll be able to know if our project is a success by the number of chimneys installed per month, and also in the reduction in reported smoke-related health cases, that's URTIs in the community. And also we'll carry out the household satisfaction surveys in the community after a given time, which we'll decide. And also by the number of artisans trained from the same community, and also through repeat customers and referrals. The fair advantage of our project is a first mover in Tongaren addressing kitchen smoke, plus URTIs with a practical, affordable solution. And it's also a community trust through health-based impact. And the next is the local production and installation. The last one is through social proof, healthier families and reduced clinic visit. So this project may look simple yet impactful in the community. It will help majority of the people who are suffering or are predisposed to URTIs in the community. So this project is a big game changer in the community, which I believe if it is implemented, it will bring a big change to the people of Tongaren. Allow me to rest my case there. Thank you.
So thank you very much, Tongaren Station. I think you have all heard the presentation. You've seen the slides. Any comments with respect to the project as presented by the representative from Tongaren? Manuel? Members, questions?
Yeah.
for Tongaren?
Let us engage the students, please.
Yes.
You've all listened to the presentation. Janet, you want to say something?
Yes. Although I didn't start with Manuel from the beginning, but I've captured quite a bit, and I want to affirm him for a job well thought of. That is quite going to be very useful to the community. I have a few areas that are not clear to me. Maybe he might have already addressed in his initial remarks, and I missed out. I'm sorry if I will be taking him back and the general group. I want to ask the Tongaren team, first of all, how will you buy in the support of the community members and community leadership? Apart from providing posters, apart from sensitization forums in the community, I don't know. I didn't actually capture how you will buy in the support of the community. And I was also thinking probably you should also think about leveraging on their forums, because if you just decide that you come up with your own forums, it may take you a bit of time and a bit of your resources. But together with your own arrangement, if you leveraged on their own forums, for example, they are usually in a week, there are usually those chiefs barazas. There are usually also forums in the churches. You mentioned about churches. How about the other religions that like Islam? Could there be other forums that you can leverage on? You are talking about community artisans. Now, I don't know how you will bring them on board. So matters sensitization or providing knowledge and information to the community, I'm not convinced how you will convince them to buy into your idea. Then number 2 is on your budget. I have a challenge on concern on your budget. You mentioned that you will buy bricks. At what point do you bring on board the community artisans if you have nil for transport? That means you will prepare the bricks. Who is this that will help you if it is not the community artisans, those who are trained in matters preparing these bricks? And therefore, isn't it important that you look at the other materials that will be required to prepare these bricks? There are so many other materials that you will require, which should be included in your budget. Otherwise, that's a very good idea that you want to do this work at home and not, expanding your budget. Then one of your result is the number of chimneys installed per month. What happens when you have a big household where you will be required to install 2 chimneys? I don't know, how will you bring or how will you account for the number of households? How will you account for the number of institutions, and yet you have not mentioned them in your results? And finally, kindly budget for the posters. Otherwise, I'm also challenged. This is a very noble idea. I'm actually challenged. I wish you brought on board the teachers or the educators in the schools, because you will need those schools to support you if you are thinking of working with them. Thank you so much.
Thank you very much for that comment, those comments. Tongaren, do you want to respond quickly?
Yeah, and encourage all the other students from the group to
You have a
support.
team of over 11 at Tongaren. I was with you, week 1. Tongaren, how are you going to buy in the support of the community and the leadership? With your posters, you need a budget.
Okay.
Go ahead.
Thank you. Thank you for the question. I didn't capture the name very well, but thank you for the question and the concern. I'll answer the first question, then my mates will answer the next. How will we buy in the support of the community? So I want to assure you that during our first day in the Tongaren, we were able to interact. We carried out something we called community entry. We interacted with all the local leaders in the community. And also during our stay in the community, we were able to interact with the locals in the community. So there's a good rapport between us and the community, and we already explained the project to them. So what we are only remaining with is the implementation, but they already know our project, and we already explained to them everything. So I don't think if this one will be a big deal to us, but thank you for your concern. Yeah.
Prof. Paridawa, I think also to add on to what Emmanuel has said, we always encourage the students to do what we call community-directed interventions. And by that, they sit together with the community, they explain the pain points that the community has raised. Remember, when they are doing the community entry, they get to meet the area chief, the village elders, and the opinion leaders. So these pain points come from the people. So they're working together as a team to see how best they can solve this problem. So they own it, but the students are the cheerleaders. They're the ones who are telling them, yes, it's doable, and this is what you will need. And maybe we can start with a demo center, and the demo center was meant to be in Tongaren, the health center itself, improve on what is already existing, and then the area chief, the village elders were the next batch, and then the jamas, the mamas who have the merry-go-rounds. They can even do it from one homestead to another in form of a merry-go-round. That was the idea that this Tongaren group had.
Well, if I may just come in briefly, when we talk about education for sustainable development, we usually emphasize the use of locally available materials. Yeah. So I was wondering, what local materials or technologies are the members of this group using to make the project cost-effective and sustainable?
Back to you, the students in Tongaren. What is it that you saw that is going to help you? The clay soil? Emmanuel and group?
Okay. So in the community, we noticed that there are a lot of bricks. So we'll be able to get them at a cheaper price there than to get them from far away from the community. And I think that's the only thing, the bricks and all those things are there in the community. So we'll not be able to go and buy them far away from the community. But we'll try to minimize the cost by cutting out things which are not important. Yeah. So maybe if my friends can help.
Yeah, just to help them out, Tongaren, you mentioned something about the community artisans, and you talked about something. Tell the listeners what you are suggesting, who the community artisans are going to be, because I think you also added an aspect of training. Tell them, you have the information, Tongaren. Community artisans, you are going to train the youth because unemployment is very high in Tongaren. Expound on that.
Exactly. That is what we want to hear. That is what makes this more interesting and inspiring.
Okay. So I don't know how we're doing for time. I think Daktari Akam.
Yeah.
There's another question that came up for this group. How do they budget for the costing in terms of transport? And I think what they needed to say, Tongaren, the area where they were the model hospital, they were able to see that the youth are making the bricks, but the bricks don't have market. So we are trying to empower them by making use of these bricks that they already have, train them on how to make these chimneys for the mamas in the village so that they can conserve on the energy. And then in doing that, they are going to reduce on air pollution in that area. So by empowering them, the youth will be occupied. And in doing this, you are improving their health. Our core business this year was One Health for All by trying to come up with innovations where we are going to solve the health problems. So the innovation here is the idea of them using what they already have, the bricks that have no market, to try to improve the air in the house in terms of getting this chimney done well so that they can be able to reduce the amount of smoke and reduce the amount of fuel they are going to use in that household. That was the innovation that they were thinking about. There is also the issue of involving the schools as partners in this. Again, as they said earlier, it's an idea that they're having, and they'll be bringing in more partners as it's evolving. This is an idea that they are pitching. Once they make their prototype, maybe by installing the one at the Tongaren Health Center, they'll train the youth, and then they'll be able to scale it up to the village and to the other community members. Thank you.
May I
No, I
also
think
add, allow me, in
yes.
terms of sustainability, these artisans that we shall identify are going to sustain the project in the sense that while the group is away, this particular group will continue with the idea. So my question would be, at what point are we involving them? So so that whoever participates in the activity should be left to continue with the idea, with the implementation, so that at the end of the day, we can feel the impact of the group in the community while they are away. Thank you.
Group members, can you respond to that one? Yes, I think once they start off at the institution, which is the health center, that's going to act as a demonstration so that people, as they come to the facility, they're able to see and they're able to conceptualize the ideas. And then, of course, they mentioned something about starting off with the opinion leaders in the community. Again, those are places where anyone and everyone, when they get an opportunity, are able to visit the place and see what is being done. Now, with the community artisans, I think what they should incorporate is to add a training component where the youth will be the ones, and maybe even think about TOTs who will be trained to continue with the continuity with the training and the maintenance activities for others to also continue, so that they are able to adequately address this aspect of sustainability. Thank you. So Dr. Kama, can we move on to the next? Dr. Christina, do we move on? Next group?
I am seeing there's something in the chat, sir. There's an issue about somebody wants to know. Yeah, somebody wants to know the education part. Will the students be able to educate the mamas on the dangers of indoor pollution? This again was one of the talks. Once the students are out there, they give talks about sanitation, they give talks about air pollution. When they're there in the community, these are the day-to-day activities that they do. They talk to them once they're at the health center. They talk to them in the barasas. When they are doing the focus group discussions, they talk to them about this. So sensitization has been done, and as part of the project, they'll be having these TOTs. The TOTs will continue emphasizing on the need to minimize air pollution in the houses and the dangers that come with it.
Thank you, Dr. Kama. Continuing with the chat, greetings to everyone from Dr. Young Tello, President of Go Green. He's saying, network with me to impact our society and Mother Nature. He has put his contact there, Tongaren Group. Please take note of that number and get in touch with Dr. Young Tello so that you are able to, push your issue further. Any other comments in the...
Yeah, I think as we continue looking at the comments, you can usher in the next group because of time.
Yes. So the next group is
Chepkorio
or Kamusoro? Dr. Kama?
Chepkorio, they're coming in with an innovation on NutriPill. So welcome them in.
Chepkorio Group, okay, when you're ready, please.
Okay, I'm Kevin Mutai. Let me share my screen.
Okay, Mutai. Again, can you speak again?
Kevin Mutai.
Kevin. Okay, good. Yes. I got you. Perfect. Go ahead, Kevin.
Okay, just a minute. Okay, so can you see?
Yeah, it's coming on. Just continue.
Kevin, you can continue talking as your slides are loading.
Okay, good morning, good afternoon, and good evening, everyone, wherever you are. My name is Kevin Mutai, a member of Team Chepkorio, comprising of 15 students from the various schools within the College of Health Sciences. And today I'll be pitching for NutriPeel. So this is our first slide. Can you see it?
Yeah, can you use the slide share mode? If you look at the screen below there is the thing that looks like what can I say? A desktop.
A cup for wine.
Yeah.
I'm
Click
unable
on
to
that.
see that.
Click on that icon. Are you seeing where you
Koboko.
have notes, comments? Then you have 4 dots. Then you have something like a book, and then the last one. Click on the last one. Below the slides. Below the slides. Is it orange? The yellow orange line. English. Are you seeing that?
Yes.
Yeah. Along that line, there is something at the end. Note that. Go, just continue. I'll see the next one. No, not that. Come to where we have something like a book. Okay, next, the next one. That one, yes.
Okay. So you can now see clearly.
Yeah, good.
Okay,
Continue.
so let me reintroduce myself. I'm Kevin Mutai, a member of Team Chepkorio, and will be presenting for NutriPeel. So every day, tons and tons of potato peels are thrown away in our community. At the same time, stinging nettle grows everywhere as a wild plant. And at the same time, families are struggling with poor nutrition and they can't afford expensive supplements, they can't afford healthcare, they can't afford to eat healthy food. So what if I told you the solution to both these problems lies within this slide, the potato peels and the stinging nettle. So here are some of the photos we took at Chepkorio of the stinging nettle growing wild and of the potato peels. So what exactly are the problems that we are trying to address with this product? So in Chepkorio, like in many other parts of Kenya, people face a persistent nutrition gap. Families lack access to affordable and nutrient-rich foods, leading to deficiencies. On top of that, households have limited financial resources for healthcare. So they have to operate within a tight budget. And most of the time, or some of the time, healthcare and nutrition can take a backseat, leaving these families vulnerable to nutritional deficiencies. Thirdly, there are underutilized local resources within the community, such as nutrient-rich potato peels that are often discarded as waste, and stinging nettle, which often grows abundantly everywhere, grows in the forest, grows along the fences, but no one minds it. But at the same time, this stinging nettle is rich in nutrients, and if tapped well, it can be leveraged for economic and nutritional benefits. So within the market, there are already existing alternatives. Imported supplements, there are fortified foods, there are commercial nutritional supplements like iron and vitamin C tablets. There are all these other existing alternatives. There is already the plant-based nutrient products that are locally available in supermarkets like Moringa. We have all these other plant-based nutrient products. So why is our product better than these other products? First of all, most of these products are too expensive. They are limited in nutrients, or they just don't fit into the local diets. The people are not used to these types of food. They have not interacted with these supplements. They have not interacted with these fortified foods while growing up. So they may not necessarily be willing to embrace it. People need something that's affordable and accessible and culturally relevant to them at the same time. So what is the solution that we are proposing is NutriPeel. NutriPeel is a natural, affordable, and nutrient-rich supplement made from fish peels and stinging nettle. It is affordable, it is sustainable, it is scalable, and it has several health benefits through antioxidants that fight radicals and proteins that support growth and strength. By creating this product, we are able to turn everyday waste, that is the potato peels and the stinging nettle that grow in the wild, into wellness, into both economic wellness and nutritional wellness. So this product is affordable for the families that are already struggling to survive within limited budgets. It's eco-friendly for the planet, and it is locally produced. So the processing of this product includes a collection where we gather the potato peels from the farms, households, and markets. We harvest fresh stinging nettle growing along the fences, growing in the forest. We wash these peels and nettle to remove the dirt, dust, and impurities. We sun-dry these potato peels and stinging nettle. We sun-dry the stinging nettle to remove the sting. We then, after these products have been dried, we then grind the dried potato peels and the nettle into a fine powder. So we mix the powders in a set proportion with other local protein sources such as pumpkin seeds, which are also thrown away as waste to enrich the supplement. We then package the product and sell them at an affordable price to the households. So these are just some of the benefits of NutriPeel. With NutriPeel, families can access affordable quality nutrition without breaking their budgets. Some of the benefits within the potato peels include it's very rich in dietary fiber that improves digestion, prevents constipation. It's very rich in vitamin C. It's very rich in vitamin B6 that helps brain function and supports metabolism. It's very rich in iron, magnesium, potassium, and most importantly, it's very rich in antioxidants that protect cells from oxidative stress, reducing the risk of chronic diseases. In the case of Chepkorio, a lot of there's a very high prevalence of arthritis. So by introducing this product to the local community, I think it will act as a preventive agent, reducing the number of arthritis cases within the community. So some of the benefits of the stinging nettle include it's very, very rich in protein as compared to other products like cabbage, kales, and spinach. These have about within the range of 5 to 7 grams of protein within 100 grams of them dried. But with stinging nettle, we have 25 to 30 grams of protein per 100 grams of dried stinging nettle. So it's very, very rich in plant protein that supports muscle growth, repair, and overall body function. it's very, very rich in vitamin A that supports vision, immunity, and skin health. It's very rich in vitamin C that strengthens immunity, is an antioxidant and aids in iron absorption. It's very rich in vitamin K, crucial for blood clotting. It's very rich in iron, calcium, and potassium, and also very rich in antioxidants such as polyphenols and carotenoids. Also, to add on that, not only is it a nutritional product, NutriPeel can also act as a cosmetic product. The potato peel has enzymes that are able to naturally brighten the skin, creating an even skin tone and adding a natural glow. The antioxidants from the potato peels and nettle fight free radicals, reducing wrinkles and fine lines. So it has anti-aging protection, and it also has acne and oil control. Nettle has antibacterial and sebum regulating properties that help reduce acne and excess oil. It has soothing and anti-inflammatory properties that calms skin irritation, redness, sunburn, and eczema-prone skin. It has deep nourishment since it's rich in vitamin A, C, and K. And it's also an affordable alternative, considering how expensive most of these skincare products are. So what channels are we doing to market our product? First of all, we have local markets, SOCOs. So in Chepkorio, the local market operates on Monday. Here we'll have direct access to households. Most of the people that are selling within the local markets are already trusted by the local community. They will sell this product at an affordable price. We have cereal shops that already sell health and agricultural products in these rural areas like Chepkorio. We have the pharmacies and chemists, supermarkets and mini-marts. We have the health food stores. We can also market it through social media, through Facebook, Instagram, TikTok, WhatsApp. And this will also be a cost-effective promotion. Since we can market the product ourselves, we have e-commerce platforms like Jumia, Kilimall, and we can also market it to schools and hospitals who will be able to buy it at bulk. So what is the advantage we have over the other? What makes NutriPeel be? So NutriPeel is cheap and made from abundant molecules, so that's why it's cheap. It has a dual value. It tackles three problems at once: a nutrition gap, a food waste reduction, and also empowers the farmers and the local community economically, enabling them to be able to access better healthcare and better food. So we have a community connection. Since we already did our community diagnosis and entry within the community, we already have built trust, and we have already acquainted ourselves with the local farmers, building trust and loyalty that these big brands can't replicate because they are not directly in the community. Another unfair advantage we have over the competition is the affordability edge. Since our product is cheaper to produce compared to like whey or soy isolates, it makes it more accessible and cheaper for everyone to be able to afford it.
Kevin, are you done?
No, not yet. Our customer segment. So who are we intending to sell this product to? So we have low to middle income households. We have healthcare facilities and community health programs. We have health conscious individuals. We have schools and feeding programs. and we also have sports and fitness enthusiasts. So our cost structure. So we broke this down into two tables, the fixed costs, which will be incurring once, and the variable cost, the cost it will take to produce 1 kg of NutriPeel. So for fixed cost, we have rent that we estimated at 8,000 shillings. A grinding machine will need two, one at 20,000, so that's 40,000. We'll need a signal business permit for 5,000, a food and hygiene certificate for 5,000, partnership registration for 2,000, salaries for 20,000, and the total fixed cost is 80,000. For the variable cost, to produce 1 kg of NutriPeel, we'll need 2 kgs of potato peels, priced at 100 shillings. We'll need 2 kgs of stinging nettle, priced at 100 shillings. Packaging 1 bag for 20 kgs is, for 1 kg is 20 shillings. Printing will be 3 shillings, electricity 5 shillings to produce 1 kg, water 5 shillings to produce 1 kg. So the total variable cost for producing 1 kg of NutriPeel will be around 233 shillings to produce 1 kg of NutriPeel. So the key metrics, how will we know that we are making a profit or we are impacting the community? So the cost to produce 1 kg, we have priced at 233 shillings per kg, and the selling price will be 500. So the gross profit per kg will be 267 shillings, which is about a 53.4% gross profit margin. And since the fixed cost is 80,000, to be able to break even on the fixed cost, to be able to repay all the money we used in the fixed cost, we'll need to sell about 300 kgs per month. So I want to invite you to join us. Together we'll be able to turn this waste into wellness, empowering the community both economically and health-wise. So thank you. I'm open for questions. I'm done.
Thank you, Kevin. Any responses from those who are listening? This is a very interesting way of trying to see how best we are using waste and the natural environment. Comments? Suggestions for improvements? And possibly guide them on the way forward. First, please.
Yeah, this is a room where we all learn. Please just be free. Ask a question, give an insight. What has touched you? What are you learning from the students? Because we are talking about education for sustainable development, and education for sustainable development is about these students. It's about the future. What are you learning from them?
Madam Christine, can I just put my views on?
Yeah, please do.
This is Dr. Sewe.
Yes, Dr. Sewe.
Let me say hi to the whole group, morning, evening, good afternoon, wherever you are in the world. I'm very happy with my friends. I've just came in late, but I've already catch up with what my friend Mutua is saying. My question is, for you to go to a bigger market, I don't know what share of market are they targeting. Secondly, how do they safety, efficacy, and standards? How do they work on that? Because on his clip, I've not heard about the standards of the products. Thirdly, have they registered the company with the KIPI, Kenya Bureau of Standards, so that they can be accepted in the local markets? Because I've heard him saying that sometimes they are marketing even in pharmacies, local markets. Can you just brief us on that so that we can have a glimpse of what is happening? Thank you, Madam Christine.
Well, thank you so much. Go ahead, Prof.
You see, thanks you for the question. You see what's happening? These students went out to the field, they saw an opportunity, and now they got an idea out of that opportunity. In terms of standardizations, they have not yet prototyped their idea. They have not gone to the labs and measured. What they are doing right now is what we call pitching the idea and trying to see whether it makes sense. I agree, by the time they reach that stage of prototyping, they should have been able to do the standardization and then be able to tell us how does it differ from the others in terms of the quality, quantity, how they are going to ensure ethical issues, the standards, the CAPE standards are adhered to. They are still at the ideation stage. Thank you.
Okay. Dr. Sewe, are you answered?
Yeah, I'm totally answered, Madam Christine.
Thank you so much. Yeah, there are quite a number of comments from the chat. Maina from Kenya says that is the way to go. You are addressing a key issue, and the fact that it is medicinal is a great move. Shall you be partnering with any pharmaceutical company? Eno says, very insightful and powerful presentation. Yes, indeed, we can convert trash to cash. Good. Alex says, this is powerful. I would like to understand how to use it. How long does it take for the product to expire after production? And then Agnes is saying, I am Agnes. I really don't know why my mic doesn't work. I have been trying. Oh, sorry. Sorry, Agnes, you'll get the recording. Okay, so go ahead and respond to those few questions, please.
Daktari, can I add another question?
Yeah, go ahead, Janet.
Thank you. Likewise, I think I want to also appreciate them. This is a well thought through idea. Keep it up. However, I would like to understand at this level, this is a starting point, and you are already thinking of paying a salary. I'm just imagining this could be very, very expensive if we have to go the salary way. What if we started with what do we call it? What do we call it if it's not a salary? So that you are not, a salary is a huge amount and it
Stipend.
must be consistent. Yes,
Stipend.
and it must be. Okay, just come up with a better term that will make your expenditure slightly cheaper at this particular point. Probably you are thinking big, which is very good. But for a start, and at your level, probably we can come down kidogo to just lower your standards kidogo. Then I would also want to know, how will you cater for the poor households who may really need this particular remedy? Because that cost for that particular remedy may not be achievable by all members of that community. So what strategies are you putting in place so that you are not discriminating in terms of the cost? And finally, this is from my personal experience, what I have gone through and what I've seen many other people who come up with a new idea, a remedy to address a challenge. That as you plan and even implement your strategy, you still come up or you end up creating a challenge to all the three teams. As you are thinking about your idea, did you discover that probably as you are implementing your strategy, another challenge may come up? That was just an afterthought after listening to you. Thank you for the opportunity to learn and to share with you.
Team Chepkorio, can you take up the questions?
Okay, so regarding the salaries, I think we had other alternative of paying the people who are supposed to pick the stinging nettle and collect the potato peels a commission on how many kgs they are able to collect. So we'll be able to set a specific price if you collect about, let's say, 1 kg of stinging nettle and 1 kg of potato peels, and dry it and bring it to us as a product that has already been processed. Then we pay you a commission on the per the kg. Regarding how long the product takes to expire, since it's a powder, the main enemy here is moisture. So if you're able to keep the product away from moisture, it will be able to take about 6 months to expire.
So there is the other question about affordability in the communities for those people who will not be able to afford. How will you cater for them?
Okay, so within the customer segments, one of our proposed customers was the healthcare facilities. So we are thinking about a plan where the healthcare facilities will be able to subsidize these products for individuals who need it but are unable to afford it as a supplement.
So are you going to subsidize only for the health centers, or you are going to subsidize on the costing in terms of materials, what you are using, the production cost to make it pocket friendly? Think about that. Look at the production cost and how you are going to reduce it so that at the end of it, your pie product, you are selling it at a cost friendly price.
Okay.
Let me also add a question. Dr. Ari, I hope you can hear me.
Yes, Director.
Now, my concern is, and I don't know the extent to which you did your survey to set, because I've had you mention of the stinging nettle, and it seems that is the key resource that you need for the production of this product. How much of it is available in that community? Or is it something that if you get the resource to implement, then after 1 month you have exhausted the stinging nettle that are available in that area? The much that you found, are they grown? Because I know stinging nettle usually grow naturally, unless I can be challenged otherwise. So if they grow naturally, probably in the hills or along the rivers, and you have done a production of amount X, and then because of the changes in seasons, then we are in the dry season, and then there is minimal vegetation, of how I know some sections in that western region. How do you think you can sustain the production of this product so that it's not just a 2-week thing and then the raw materials have been exhausted? And is there an alternative to that? Or if is that the main one, then probably I would want to hear what is your sustainability plan in terms of the raw materials, with the key resource being stinging nettle, unless it's not.
Team Chepkorio, are you able to tackle it up?
Yes.
Yes.
So regarding sustainability, the first phase of production will involve collecting and harvesting these products, this stinging nettle that's growing in the wild. But after some time, we'll roll out an initiative teaching the farmers on how to cultivate this stinging nettle and intercrop it with potatoes, maize, and beans, and all the other crops that they are able to grow within that community. So we'll first start by collecting the wild nettle, and then after time, we'll now roll out initiatives to teach farmers on how to actually grow this stinging nettle. What was the second question?
Yeah, and I think the second question, Chepkorio team, it was the production cost. Do you have an idea? And then there was also a question on the nutritional benefits.
Let me make a follow-up question so that he can just tackle it once, because I had
Yes.
So the thing is, have you maybe considered whether we got seeds of stinging nettle in some agrovets? I don't know if that's the place where you find seeds, so that when you want to invite farmers to plant, where would you start from? Yeah, that was my question.
So regarding the seeds are available within agrovets, mainly in towns. Once we teach the farmers on how to plant the stinging nettle, we'll train them to only harvest mature leaves, like how they do for tea, where they only pick the mature leaves and leave the rest so that it will be able to regrow. That's how we'll be able to sustain this initiative.
Mm-hmm. It is very powerful. Professor?
Yes.
We have one more
I
group.
think
I think the group will present and share everything that is in their hearts within the few minutes remaining, or we can carry them forward so that we exhaust for these two groups.
with just these two groups, Kamosor is yet to present.
Mm.
Are they available, Dr. Kama?
I suggest we exhaust these two groups today, then we move Kamosol to next week.
Okay, so that is fine. But I think, yes, so Daktari, we want to hand over to you so that you guide us on the way forward.
Yeah, I think that is fine because there are still some questions on the chat.
Yes.
Yeah, please go ahead.
Let's look at the questions. Dr. Barasa, is it the first one? It's a very good idea. However, what are the nutritional benefits? I think that one we've mentioned. Then from there, the commission issue has been addressed. So let's go down. So Dr. Baraza says, I truly appreciate the projects the students are carrying out. They realize the link between education and sustainability. For education to be sustainable, it must go beyond the classroom and equip learners with special practical knowledge, skills, and values that help them respond to real community challenges such as climate change, food security, and responsible resource management. So I don't know if they will be able to answer that, but maybe on their behalf, I think this is something that we have to think about when it comes to the weather changing, climate change. We have to see how best they actually are able to store up enough supplies for them to be able to produce and to ensure that they are taking care of anything that is being changed as a result of the climate. You know very well with seasonality, the food security issue also changes, and they must also now monitor that, but at the same time, be able to mitigate and making sure that they have enough resources for them to continue with their respective activities. They have to think about preservation and hygienic measures. I think maybe Chepkorio, any comment on that? And the other last but not least is can promote stinging nettle farming? Food for thought. During the high harvest, the production will be also high. Let's see, to care for any eventuality or drought. So I think that one will be taken care of if they do their planning well. They have enough supplies for during the drought period for them to continue with production of that particular product. Then let's see, I would like to know how the mixing of the stinging nettle and the potato peels are done. I guess proportionality has to be outlined. Chepkorio, tell us how much potato peels is mixed with the stinging nettle and in what proportions? Any idea?
Yes.
Go ahead, answer the last one.
For the best product, we discovered that the best proportion to mix this is 55% stinging nettle and 45% potato peels to bring out the benefits of both products. So the second question for preservation and hygienic measures, in the cost structure, we were able to budget out for water, and we budgeted out 5 shillings to produce 1 kg of stinging nettle. So we have already budgeted in water. So during the processing of the product, we collect the stinging nettle and potato peels, and we wash them first before drying. Yes, I think I've answered the questions.
I think, Team Chepkorio, you might need to see how best you can be able to adhere to the standards in terms of, like, after you have washed and dried, and then is there a way you can heat treat or steam treat the product so that you kill most of the bacteria and the fungi before now you do the apportioning of the portions, the 55 and 45. You might need to look at that and see how best you can calibrate so that the product that comes out is hygienic and meets the standards. That's one thing that you might need to do in the labs.
Yes.
Mm-hmm.
Now, the other thing that I feel this project, personally, it's very viable. But then I'm looking at this project in totality. Does it have a low hanging fruit that one can easily pluck as you cascade to get to the bigger part of it? For example, what if the group would find even the smallest piece of land, then find the cost of the seeds, and then put up a nursery for stinging nettle, for example. So that will be like the first phase of it. Then through this forum, then you can record the process of growing that, because the beauty of your project is this might look like a pilot, but also a real thing. So that we say you have found a small piece of land, small in whichever respect. I don't know the specific measures that I would say. Then find the specific seeds of stinging nettle. Then put up whether it will be a nut record phase. We can also do another phase of it. If you just went to the wild and plucked the stinging nettle, the potato peels, then do the mixing in whichever standard. Then let's see up to that level, what do we have? The reason why I'm looking at this is that we don't end up with the pen paper stuff where the raw materials ran out. And well, I don't know the many reasons why the pen paper did not pick up, but then one of the reasons that I had, I could be wrong, was that the raw materials ran out, and then people sort of invested in other things like sugarcane and stuff. So that as procedural as that, it is very evidential when we say we will train the farmers, because we already have a prototype of it. So if we will say that the next phase of it will be like 1 or 2 or 3 months, and this will be, the cost will be very minimal. I don't know the cost of the stinging nettle, whether it will be in the community or somewhere in the school, to just get a small garden, put in the nettle. Let's see how they come up. And then, because eventually you'll realize that the process will be like 50% done, and you may not be still waiting for like an investment of staff, so that by the time someone puts in, or a company or someone has to put in their money into that project, someone has already seen the evidence of its progression. And looking at it, I don't think there's anything that you need which is out of reach that we can say we will wait for it for we to have it. So if the group would consider, find a place, find the cost of the seeds, put it up, record the progression of it, get the stinging nettle, do the mixing in whichever standard before you get the right measures, put it up, and then you take it up that way.
Yeah. Well, thank you so much. And there is a pertinent question that somebody has, Enos set it particularly, specifically for Dr. Christine. Dr. Christine, given that you have a platform and a stake in Kenya's education system, how can ESD be fully mainstreamed in CBE? And I thought this is very pertinent and timely because indeed education for sustainable development must be at the heart of every country's education, especially countries like Kenya that are running the competency-based education. Why? Because the challenges of our century, like climate change, inequality, food insecurity, and technological disruptions, demand that learners who are not only knowledgeable need to go beyond and become responsible, innovative, and future leaders. And so they have to be ready for the future. Now, from my perspective, there are 4 strategic pathways for fully mainstreaming ESD in CBE. The first one, of which I know, before I left the ministry, we had started doing this, is curriculum integration. ESD should not be treated as an add-on, but woven into the fabric of all learning areas. Competencies such as critical thinking, problem solving, collaboration, and value-based leadership are already emphasized in CBE. This can be deepened through education for sustainable development content, whether it is environmental stewardship in science, sustainable livelihoods in business studies, or peace education in social studies, and so on and so on. Just the same way Moi University is doing. This is what CBE should be. The second thing is teacher capacity development. Teachers are anchors of change. For ESD to be mainstreamed, teachers must be trained not only in content knowledge, but also in transformative pedagogy, facilitation methods that encourage inquiry, project-based learning, and community engagement. Teachers training in institutions, public institutions, private institutions, higher learning institutions, and in-service programs like KEMI should prioritize education for sustainable development frameworks. Very, very, very important. Another thing is community-based learning. Just like what Moi University is doing with COBS or service learning, CBE already emphasizes experiential learning. By aligning this with ESD, learners can undertake school community projects such as waste management, tree planting, water conservation, and social entrepreneurship, among others. This grounds ESD in real contexts, ensuring that learning translates into impact. Remember, in education for sustainable development, we always emphasize that at the end of the day, it is the result. It is the result that we are looking for, and that is what we will call impact. Rather, we have made a difference. And then the fourth a strategy that can be employed in Kenya and other countries that are working on competency-based education is policy and partnerships. Yeah, mainstreaming requires strong policy backing and multi-sectoral collaboration. Let it not be just, it is this, it's just about education, Ministry of Education. No, Ministry of Education, universities, NGOs, global partners, like now you come here, you meet partners from the NGO world, from all over the world. And this must align efforts that ESD is not just rhetoric, but a coordinated agenda. It has to be coordinated, that everybody is in it. Kenya's leadership, as well as other countries' leadership in the ESD for 2030 framework, gives us an opportunity to set a model for others to follow. So it is possible this can be done. And I have said in the ESD group that mainstreaming ESD in CBE means moving from theory to practice, equipping learners to think globally and act locally, what we usually call glocalization. As someone with a platform, as you say, my commitment is to champion this integration from the point I can. Like what we have in Global Alliance for Sustainability in Education, we welcome everyone, including the policymakers of all the countries. We have people from the Ministry of Education on board in Kenya, Ministry of Education from Uganda and other countries on board. So when you come here, whatever you learn, it is not just for you as an individual, it is not just for your institution, it is for your country. Because we have to ensure that every learner is climate ready, socially responsible, and empowered to create a sustainable future. Please be the champion. Go to the CS of education in your country. Tell them there is something that can transform lives through education for sustainable development. And if they take it up, very good, because we have a policy for ESD. For instance, in Kenya, we had already launched the policy and we were working towards ensuring that everything is being done. And those who are in other countries, you can borrow a leaf from Kenya. Have a policy for ESD in your country that can be mainstreamed in your education system. And this can be done. My friends, see what the students of Moi University are doing. If all students in the world were learning like this, what kind of future are we going to have? So I hope, Enos, with my feedback, you are going to do something also, because you are part of the Ministry of Education. Not unless there is any other question, any other comment, I want to pause there and say, yes, we can do it. We can do it. Back to Moi University and their presentations.
Yes, thank you very much. We greatly appreciate the accolades. And what we're asking for is to now be helped our hands to take this. It is an innovative program. You have been told we use the SPICES model, of which the C in the SPICES is the community-based education and service. And we make sure that we are now addressing the problems, not just from the top-down arrangement, but making sure that we are addressing the problems for the community, with the community, from their perspective, and not us dictating. In fact, we don't go there as the experts. The community is and are the experts. They actually give us the solutions of what needs to be done. And we're saying that should we get more people on board, we would like to make sure that the image that we are now seeing of our institution should not put down the great ideas that we have. When Moi University was set up in 1984 as a community-oriented institution, it was ridiculed. We were training traditional healers. Are they now traditional healers? For anyone who has come into contact with products from Moi University, especially those from the College of Health Sciences, can attest to the fact that actually they are outstanding and they actually stand out in their own right. So we're saying that we would like to be supported to make sure we are taking this, the sing song. The new pedagogy right now is not an pedagogy, andragogy, but heutagogy. So go check out what that is. And we're saying that with that, believe us, we are likely to make a difference. We are a university with a difference. That is what our motto reads. And for those who are keen enough to see that it is actually a university with a difference. Thank you so much for allowing us this opportunity. We still have another, how many stations? Dr. Kama, and your comments, please.
I still have 16 groups that have not presented. So far, we have done 4. We were to do 5 today, but we have done 4. What I need to tell our members, these are our junior students. They just finished their year 1, went to the field to see the theory that they learned in class and try to put it into action. They have just come back from the field with ideas. We'll still keep on training them as we look at the comments you have given us, look at the standardization measures that we have to put in place, and finally, come up with an idea and a prototype that can be prepared forward. We like the idea of this Singing Neso farm. I think we can do a small project within our College of Health Sciences, get the seeds, get to grow them, and see whether we can be able to do this in our labs together with School of Engineering and School of Business, so that we are able to come up with a lean canvas model that has everything in place. Then the idea can be able to be scaled up and implemented. As we say, learning is a continuous process. We are happy to be part of this team. And as we move forward, we ask for your guidance, for your interactive sessions, so that the students are able to learn because they form the leaders of tomorrow. Thank you, everyone, and have a blissful night. Thank you.
This is just, I don't know what to say. I think you should tell your colleagues who are not coming here on Sunday just to listen. They're missing a lot. There is something very special here. And from here, we are all going to thrive. I believe no one leaves this platform and they remain the same. Just the fact that we are learning something, even if it is small, it is something to carry on to see us to the next Sunday for another session like this. Trust me, we are going to have all the students present their work, and we are going to call other partners to join us just to listen. This is a global platform. It's only that we didn't have time to introduce people who are in this platform. We are very people who have joined us for the very first time. If you are here for the very first time, I want to give you an opportunity to just say hi and tell us where you are joining us from before we finish. Anybody who is joining us for the very first time, are you in the room? Please unmute yourself, because I have 3 screens that are full.
Yes, I am unable to. I'm not in a position to be on camera. Forgive me.
It's okay, Joseph.
Yeah, I mixed up the time. I thought was tomorrow was the activity, and I only was looking for the connection. I was trying to register, and I found this. I was surprised, but I'm very much interested in community development. In fact, I'm a proponent of community-led development approaches to solving a lot of the problems that we have. I'm calling from Grenada in the Eastern Caribbean, and I'm willing to be part of this process.
You are welcome. You're
Yeah,
very
and
much
also
welcome.
to share information. While there is a, you may know about it, but it may not coincide directly related. But I think any opportunity to learn should be seized on. Columbia University has a training program that will start on the 4th of September for people to teach public health. I can share the information with you, and whoever you know will be interested. People who can teach, who are interested in teaching public health, climate change, related to climate change.
Wow. Please, if you can share your contact on the chat, that will really help us. And
Yes, I
if you've
will.
not joined the Education for Sustainable Development group, the group is almost full if you're lucky. I'm sharing 2 links, one for the main group and another one for the subsidiary group. So if you miss the first group, you can definitely join the second group, so that you follow what we are doing. Thank you, Joseph, for joining us. And please join us every Sunday, because we have these sessions every Sunday, same time, same link. So if I fail to share this link on your platform next Sunday, just use today's link and join the meeting. So friends,
Okay.
if you're not yet there, click that link and you'll be in the group. Let me pull down another link for the Global Alliance for Sustainability in Education. In case the group is full, just join both. In the meantime, let me invite one of the board members, Mr. Liru. Please just say thank you to Moi University. Then the director will come and crown with a word of prayer.
Hello.
Hello.
I didn't get to, what did you say?
I said you appreciate the presenters for us.
Oh.
Yeah, and
All
then the
right.
director will come
Thank you. Yeah.
to finish.
I think that was a very nice presentation, and seeing the involvement of the students and getting them to do the practicals, or getting to work practically to present the work that they're doing, and also engaging in the community. I am quite impressed about this, the very practical experience that the students are having, and the very fact that they are able now even to express themselves, to present their work, and just being at the beginning of they said they're in their first year of study. That's a very great thing. So I would want to encourage them, and encourage also the university in the whole process of what they're doing, so that at the end of it all, actually, their education is not just book knowledge, but knowledge that goes into proper use and proper utilization for the good of the community. Thank you very much.
Yeah, thank you. Director, finish for us and pray.
Yeah, just a correction, Daktari. They are in their second year. These are healthcare professionals in their second year of study at the College of Health Sciences, Moi University.
Okay. Thank you for correcting. Ambassador Fanuel Ondele, are you in the room?
Yeah, thank you so much, Dr. Christine, Professor Joyce, Dr. Kama, and every other person. Thank you also for the students. And what you have done is an amazing work. I think it's something that we have always wanted to see in ESD, not just on this platform, but in different schools, in the different categories, be it primary, junior, and senior and universities. So I just want to congratulate the students and just to say this is the start of the big things that are ahead of you. Change is not easy, but the commitment to it is what we have to embrace at all times. So thank you so much for the teachers in the room and every other person, even whoever is a non-teacher but an enthusiast of ESD. We look forward to more of the times here and even as we upscale. So let's pray. Thank you, Lord, for this evening. Thank you for the grace that you have given us. Thank you for your breath that you have breathed in us because we are alive. We thank you because it has pleased you to allow us to congregate and think about how we can make change and make this world a better place than we have found it, that we can create a lasting legacy through sustainable development and ensure that the generations that come after us have something to enjoy, and that the foundation we build will also leave them with something that lives also for the generations to come. We pray that, Lord, you will inspire us with your wisdom, with your knowledge, with your innovation, that what we get, not just in this platform, but in the different sessions that you have prepared for us, that we shall learn and also pass it over to others. Bless the teachers, bless the students, bless the parents, bless everyone that is on this call and others that will be joining us, that your word shall become flesh and live in us. We thank you for this day. Be with us now and forevermore. Amen.
Amen. Thank you so much, and God bless you. Have a good night, those in Africa. Yeah, I hope you joined the groups. I'll usher you in. Goodbye.
Yeah, good night, good night. And I have included the information on the course that Columbia University is offering, and it's free.
Thank you. Thank you for sharing that information. Joseph, please let me talk to you immediately after this. Thank you. Okay, goodbye, everyone.
Bye. Thank you.
Bye. See you again next time.